Okay, Dan is back. Let's see if we got Dan for real this time.
Can you hear me?
Yes, Dan, we can hear you.
Awesome.
All right, can you hear us?
Yes, I can hear you. Is the sound quality okay from my end?
Yeah, you're decent. You're decent. Okay, so I think then we have everybody and we are now streaming live. So first of all, thank you everybody for joining us this evening for should be an interesting live podcast roundtable on the very non-controversial topic of masking in schools. Unlike, many of the arguments have been taking place in Facebook pages and school board meetings all over the state and all over the country, we're going to kind of go beyond the initial question of whether or not masks in school are a good idea. I think I speak for everybody on the panel when we say that they are. And this is going to be more about talking about kind of how we got here, how to navigate these situations, and where to go from here. We have a fantastic panel this evening. I'm going to introduce them all briefly. First, we have Lisa Longo, who has managed and worked on campaigns for candidates from from school board to state house, all the way to the White House. In addition to running her own political consulting business, Lisa is also the former president of the Phoenixville Area School Board, served as treasurer of the PA Dems Women's Caucus and the Chester County Democratic Committee. Her focus is now on policy, especially public education, and has also served on the Biden Public Education Policy Committee and was co-author of a white paper on safe school operations during and post-pandemic, as well as author of a paper on the hierarchy of decision-making and funding of school districts in the USA. So thank you, Lisa. Dan Gryzbeck is running for school board director in Bethel Park, which is a suburb of Pittsburgh. He's received his bachelor's in chemical engineering from the University of Pittsburgh and is pursuing his master's in engineering at Purdue. Currently works at the Naval Nuclear Laboratory as an engineer, ensuring the safe operation and maintenance of nuclear power plants aboard the Nimitz class of aircraft carriers. In his free time, Dan mentors immigrant and refugee students throughout the South Hills Interfaith Movement, volunteers at the Greater Pittsburgh Community Food Bank, and serves as a judge at PA Junior Academy of Science competitions. And last but not least, we have Dr. Russell Patterson, who has been an educator for 20 years. He's taught kindergarten, first, third, and fifth grade in a diverse setting. His leadership skills include working as an assistant principal and currently as a principal. To increase his skills in the area of diversity, he had the opportunity to study the educational systems in Japan and Ghana while working collaboratively with the educators in various institutions within these countries. As a principal, Dr. Patterson has worked closely with community partners to bring services that will support the students that he serves. During his tenure as an administrator, his school was recognized by the PA Department of Education as a star school, being highly regarded for student growth among Pennsylvania schools. He is currently the Democratic nominee for school director in the Pine-Richland School District. Dr. Patterson attended the University of Pittsburgh, where he earned a BA, a Master's of Arts in Teaching, and a PhD in Reading Education. He and his wife are the proud parents of 3 children that are students in Pine-Richland School District. So as you can see, we've got some heavy hitters here that are really invested in the subject, and I'm really excited to have everybody. So the first question that I wanted to ask has to do with kind of how we got here, where we have these school boards, being forced to kind of have these individualized battles, in local communities. And to me, I think it obviously all stems from Governor Wolf saying that he did not support a mask mandate. He came out about 2 weeks ago and said, despite New Jersey, some other states are doing it. His quote is, I think the districts in Pennsylvania have to decide what they want to do. I think the CDC guidelines strongly recommend that schools do that. They're not mandating it, and neither am I. So I want to get some thoughts on that in terms of whether that was a prudent move or kind of a passing of the buck. Anybody want to go first? Lisa? Ladies first.
Ladies first. Okay, so I think that Governor Wolf's statement, I look back to the ballot question that was on the May primary ballots, where the governor no longer has the ability to put in an emergency order. And I wonder if that's part of the reason why he made the statement he made. But the fact of the matter is that the CDC never mandates. The CDC only offers guidance and recommendations. And it is the role of elected officials to codify those recommendations into law or policy. And we have almost always done this. For example, vaccinations. You must show proof of vaccination to enter most schools for measles, mumps, rubella, polio. Those are all only CDC recommendations. Those are not required. The requirement comes from the Pennsylvania School Code. And if you read the school code, as I have, it says from time to time we will update based upon these health guidance statements. So I don't understand why this one is being treated differently. I wish the state would act. I do wish the Department of Education and the Department of Health at the state level would add this to the list, that we have to have a mask mandate, because I do believe, especially with the Delta variant, that it's a requirement at this point. It's public health and safety.
Russell, what are your thoughts?
So, first, thank you all for having me. I appreciate being amongst these esteemed individuals. So thank you all. But I think that it is unfortunate that he didn't make a mandate. However, school board directors, superintendents, they're leaders, and leaders often have to make tough decisions. And I honestly, I'm just going to speak very candidly. I don't think it was that tough of a decision. Once we get into the start thinking about student safety, we anchor ourselves in student safety. It is not a hard decision to make. That's our priority. We're not sitting here just making up saying, oh, we want everybody to wear masks. I don't like to wear masks. And I know it could pose some challenges, but I think when we anchor ourselves in what's in the best interest of the safety of our children, I think it's a no-brainer. I think it's just a very easy decision. And I think as a leader, people should sleep well at night knowing that they've made that decision for the safety of the children, leaning on the recommendations of experts.
And Russell, in your school where you're running for school board and you're currently a principal, is there a mask mandate for the coming year?
So there's two different places. So, I'm a principal
okay.
in one district. Yep. And I'm running for school board in another district. So there is a mask mandate. I'm gonna be honest with you. As a principal, I remember coming out of the pandemic, I was like, how are we going to get out? I'm in elementary school. I was like, how are we going to get these little kids to wear masks? I'm gonna be honest. It was really the easiest part of the work. Like they kind of just, wore the mask. So it was not really an issue for us at all. I was anticipating it being an issue, but it really wasn't. And they just voted maybe night before last, to have our district where I live, where I'm running for school board. They're putting in place a mask mandate. So, cool. Yep.
Dan, what about you? Your thoughts on this being kind of punted down to the individual districts?
Yeah, I have the same thoughts as Lisa a little bit. I wasn't entirely sure about what effect the vote in the primary had on Wolf's abilities to mandate masks, but I guess looking at it more from a conceptual standpoint, it really makes much more sense for that mandate to come down from the state level. Just referring to my own district, we had our meeting last night to vote on mandating masks, and it was actually a 4-4 vote. One member was not present. She was on a work trip in California and wasn't able to vote. So right now we have no mask mandate. And from their comments, it's just abundantly clear to me that a lot of school board directors don't have the background and the scientific knowledge to really make that decision. We had school board members just blatantly saying masks don't work, citing retracted studies. There's just a lot of misinformation out there. So I think it's tough for local elected officials to make a decision that it's a lot easier for state level officials to make whenever they have the Pennsylvania Department of Health kind of guiding them and giving them the proper information to make that decision.
Yeah, and that's interesting that you bring up the State Department of Health, because in reading, it looked as though the interim secretary of health at the state level was actually, she was asked about a mask mandate, and she was kind of like, well, yeah, we'll look at it, whatever. And then Wolf was like, nope, we're not doing it. So it felt like there was a little bit of a disconnect there, as to how that all came about, or, and kind of what the thought process was. The other thing that kind of struck me was it feels as though the state hasn't really given the school districts any guidance in terms of how to navigate all of this. And what you're seeing is a lot of different groups now coming out. Just a couple hours ago, PSEA came out in favor of a full mask mandate statewide. So you're starting to see different groups saying, we've got this kind of like leadership vacuum, and we better all chime in and say what we have to say. Because otherwise, and I'm sure you've seen it in your districts, I saw it in mine, the people that are coming to the school board meetings are the anti-maskers, and they're trying, I feel it seems very similar to me, like what we saw with the ACA. If they can show up and be the loudest people in the room and shout everybody down, then they're going to try to have their way. And, I guess the question is, how do you, as, professionals who have to navigate these waters, how do you deal with these anti-maskers and anti-vaxxers that are just, this has become like a crusade for them. They've made it political. They've made it, they've really dug their heels in. How do we navigate that? How do we deal with these folks?
Jesse, real quick, I want to jump in there. I think I want to just kind of talk about that PSEA coming in support of the mask piece. And that's a critical component that I think is being left out. So, of course, we want to keep our students safe, right? But we also have people who staff the schools, so if you don't have staff, you don't have school, and so they need to be protected. They need their family members to be protected, because if my child is sick, I have 3 children, 2 of them were not able to be vaccinated. If one of my children becomes sick, I've got to be home with them. And I think everybody's aware there's a massive, highly qualified sub shortage. So that means that when the teachers are gone because they're sick, we have a hard time finding people that can fill their shoes. So, no staff, no school. So we've got to keep them also healthy and well. And that's just such a critical piece to this work. I think, and I think they're being left out of the conversation.
Yeah, it feels like like I said, I just saw it today, just 2 hours ago, they released their press release. And it feels like maybe they were a little late to the party, but they are kind of, I think, the last big player to weigh in terms of having some impact. Now, how far that goes, are they going to get to the point where they're going to be willing to, say we're going to pull teachers, we're going to do? I mean, I didn't get the vibe from the statement that there was that heavy of a resistance, but I thought it was really important that they chimed in, and it definitely gives something, another powerful voice in the room, in the arguments.
So I wanted to pick up on the thread when you said about there's a vacuum of leadership. Has anybody heard anything from the Pennsylvania State Board of Education? Because I haven't heard a word from them the entire pandemic. Where are they? Those are the leaders that would be, helping to craft this. And so I haven't heard from them, and that I'm pretty upset about. But also, I'm glad PSEA has come in now, because one of the points that I have tried to talk to people who are against masks, they're like, well, my child doesn't need to wear a mask. But they do, because of the adults who might be immune suppressed, faculty, staff, volunteers, grandparents in multi-generational homes. There are all these factors that people aren't aware of. And we need to speak really clearly that, I talked to a mom whose son medically cannot wear a mask. And I said, there are exceptions for that. That's when everyone else has to be masked. And when it took us about 2 hours to get to that point, by the way, going back and forth in this conversation, until I finally understood her point. She understood my point. She's like, whoa, wait a minute. Are you saying my child, because he's medically incapable because of a medical condition, wouldn't have to wear a mask? And I said, that is my understanding. It's written into the rules. So I think it's important that when we come across people who are resistant to the policy, I'm tired of people saying, oh, they're just stupid or they're just ignorant. No, they have different concerns than ours. Some of the people may be conspiracy theorists, but I think the bulk of the parents, they're being told misinformation, they're believing it. And it is up to us in the public education realm to educate them on the truth and the facts and just state them respectfully. I think it's super important that we do engage and say, we're doing this so we can keep schools open, because the other point people have to understand is if we get into a cycle where we have to close down schools and reopen, the cost of that is so overwhelming that we will be in a funding nightmare and we will have to see property tax increases. I mean, there's just so many layers to this problem. It's very complicated.
I'm sorry, Dan, were you going to say something?
No, I was ready to, but you can go ahead.
Okay, so, well, no, go ahead, because I'm going to move on to something, a slightly different point, so go ahead.
No, I think the point that Lisa makes is a very good one, and kind of what she's alluding to is, I think it's important to remember that no matter what side of this conversation parents are on, their ultimate goal is to have the best possible education and outcomes for their child. They fully believe that that mask is hurting their child, that mask isn't helping their child, that it's not decreasing the spread of COVID. I genuinely believe that these are things that they believe. And like Lisa said, they're being constantly told in whatever media that they consume that masks don't work. You know, masks can cause a decrease in oxygen and increase in partial pressures of carbon dioxide. I mean, all these things that we know to not be true, but they genuinely believe it's true. So I don't think there's really anything that you can do about it besides what Lisa said. I mean, just be respectful, stick to the facts. One specific thing I think that is beneficial to focus on is the CDC close contact guidance. So basically that states that if a child is within 3 to 6 feet of a child who tests positive for COVID, if one of those children didn't have a mask on, they would have to quarantine. However, if both children have a mask on, then the child who is exposed no longer has to quarantine. So basically what that's saying is if we all wear masks, if we have a universal mask mandate, your children will stay in school 5 days a week. If you're not wearing masks, the likelihood of your child having to quarantine, being pulled out for 14 days, having remote instruction, that's greatly increased. And I can tell you, at least in my district, we have no synchronous remote instruction. It's entirely asynchronous. That child is going to be dealt with 14 days of learning loss.
Wow.
I think, Dan, can I just jump in there real quick, Jesse? I'm sorry.
Please.
But yeah, I appreciate Dan for bringing that up. Well, first of all, let me back up. Like I do not like masks. There are some days I'm offended by my own breath, especially after coffee or something like that. Like I don't like the masks. I don't like to wear them, but I'm going to do what I need to do. But that whole piece where if they are wearing masks, that does limit or eliminate them having to be quarantined. And that is such an important piece, you know, especially if we're pushing for the 5 days a week, which I am as number one, as a parent, a supporter for. I cannot have my kindergarten and second grader back. I can't have them on the computer. I don't want that. But of course, as an educator, like we know, I mean, research shows the best instruction is when they're in person, they're live, we can work with them, they can do hands-on things, all of those things. I mean, research shows that. So, I mean, that's just, you know, we've got to just keep that in our minds that, you know, we want the kids to be in school.
Right. I think that was some of the frustration for me is there's this thought of, oh, well, you're basically trying to sabotage this, you know, to the people that want masks. It's like, no, we're actually trying to ensure the success of keeping these kids in school. You know, that's really kind of where this all goes. But I want to go back to something that Lisa said, because, you know, you made it sound a little easier than I think it can be when you're talking about actually talking to folks that are, you know, opposed to this. And I get it, you know, there is massive amounts of frustration. And yeah, sometimes you just want to be like, yeah, you're stupid. Like, and I get you can't do that because it's not a fair thing to say. But what do you do, you know, when you have people, and I'll give you an example that I had. I was speaking at my school board meeting as a parent, and I, you know, said, look, you know, masks work. We know that to be true. And I said, I know there's a lot of debate back and forth. I said, but what we know is there's 617,000 Americans dead from this disease. And people in the audience started to laugh. And I was like, what about that was funny in any way, shape, or form? And they were like, oh, well, it's funny that you believe that. You know, so how do you, I mean, and those were the people that were showing up. And you know, the reason that I actually chose to speak was because I wanted to make it clear to the board that the people there with the signs and the, you know, all this stuff, they were, you know, they're in the minority. But how do you deal with those folks? Yeah,
I don't want to make it sound like it's easy, because I did say it was a 2-hour conversation, one-on-one with a person, and school board directors, you're in the meeting, you can't do that. I've been on both sides of the table. So before I was elected, I was an activist, and I would show up at my school board meetings and speak, and sometimes be quite adversarial on topics that mattered to me, especially about the environment. And then once I was elected, there's a different protocol. But I think from a school board director standpoint, when you're in that meeting, you're going to maintain your composure and your professionalism and hopefully be able to do what is best for your district without interference. I mean, we had one district here at Great Valley, the meeting had to be suspended because people were just, so rude and disruptive of the meeting that the board had to adjourn. So I'm not sure, because if I were at the table, I can only tell you what I would do. And I'd like to hear what, the others on the panel would do, but I would do what Great Valley School District do. I would adjourn the meeting. And I would return to an online format, because if people can't be respectful, then we're going to have to limit their ability to put our elected officials in harm's way. I mean, I have school board directors calling me, telling me they are literally afraid of physical violence and vandalism of their homes and children being bullied. It's horrifying. So no, I don't want to make it sound like it's easy at all. I didn't mean to say that. It was.
No, I was saying like that. That was wishful thinking on my part. I'm like, damn, it'd be great if it was that easy.
No, it's not.
So then what? Do we do? That's my question. We could sit here and have a civil conversation back and forth. And I deliberately did not invite any anti-maskers on here because I didn't want that fight. That wasn't the fight, the conversation I was looking to have. But in reality, those are the folks out there that are making the most noise, that are being splashed all over the news, that are, getting everybody all riled up. How do you get past those people to have that conversation that you need?
I can only tell you from a legal perspective. I've written 2 documents that I'm happy to share. And the first one is boards were required to file a health and safety plan. Most of those plans included the phrase follow CDC guidelines. Boards do not have to vote on a mask mandate. If you included that phrase, if you said you were going to follow the CDC, you can simply institute a mask mandate. And that is probably the best way to do it at this point. And any district that doesn't, we are actually reaching out to several different organizations and law firms to see if there's a way to legally file injunctions against districts that refuse to follow the CDC because they're not following, if it was in their health and safety plan, right? The health and safety plans had to be filed, and then the American Rescue Plan money, which is attached to that, is there a way to withhold those funds? I don't know yet, but I hope so. And in that way, we will give school districts the ability to mandate masks without having that huge argument.
Okay.
Yeah.
So,
I don't
Please
think
go,
that. I think definitely. I'm trying to navigate this myself, but it's definitely not the answer to argue. I'm not going to argue. I think that especially, and that's what I say. It's nothing to argue about because we're relying on experts. I'm not a medical doctor. I'm not a medical researcher, so I'm not going to sit here and go back and forth with you about that. However, what I can say, I know what the CDC is recommending. I know what the American Pediatric Association is recommending. Until they change that, that's what I, as an educator, I, as a community member, I, as a parent, I'm going to lean on that. I can't argue with you about it because they read their stuff and argue with them about it. But that's what I'm going to lean on. So it's definitely not something to argue about.
Yeah, I think there's really, unfortunately, not a whole lot you can do about those comments. I mean, people have the right to issue their public comment at board meetings. And, as a board member, as a citizen of the district, all you can really do is listen to that comment. And if you're not currently on the board, you can do everything you can to try to convince your school board directors that it is the best choice to mandate masks. I mean, right now, whenever you have, like Lisa said, I mean, if you have the health and safety plan up as an agenda item, they can comment on that agenda item. There's really no way to stop that. All you can do is make sure that your board chooses the correct policy and mandates masks.
And look, and I'm a huge fan of transparency and public comment. When I was the school board president, I added 6 town hall meetings where we gave people voice on important issues. Everything from homework to start times to school security, budgets. I want the public to come and comment. I'm not suggesting we limit public comment in any way. I've actually had board meetings that I presided over that went till 11 o'clock at night because we wouldn't limit public comment. I also was one of the only board presidents I know. I did away with the 3-minute limit. I did not limit. If you wanted to come and you had 10 minutes worth, I was going to sit there and listen to you. Very rarely did anyone abuse that. Let me just say it's a fiction. Most people don't want to talk that long. But we did insist on civility. I had to cut off one man's mic in, the time I was presiding because he did get rude and disruptive. And I said to him, if you don't stop, I'm going to turn off your mic. And we gave him 3 warnings. And the 3rd time I shut off his mic. So that's all we can do. But I think it is important that we hear people, that everyone, have that ability to come and speak to their elected officials.
Yeah, the thing that seemed to frustrate me was it seems to be this idea that it's choice. And the thing that the way I see it is the question isn't the choice as to whether or not the kids should wear masks in school, because by your kid not wearing a mask in school, you've actually made the choice for my kid, right? That's not the choice. The choice should be, and it was funny. I was just talking with my wife about this before I came up to record. She said, we did our bit last year, keeping our kids at home. Now it's time for them. If they feel that strongly about it, they should keep their kids at home. And I think that's really been the big frustration. I think why you've seen so many parents and educators, teachers get really upset, because it's like, look, this is not just about you. How your decision impacts me, impacts my kid, impacts my family. And it feels like that seems to be like the kind of fundamental sticking point that people don't seem to understand. It's not just your decision. And is that something that you've kind of run into in terms of in your discussions with folks?
Yeah, without a doubt. I mean, I think that's the prevailing statement from people that don't want mask mandates, is that, well, I'm fine if you wear your mask, but now, you should be okay if I don't want to wear a mask. And as you clearly explained, that's not how masks work. I mean, there are terms of surface control. So, if I don't wear a mask, that obviously harms you. I think that's kind of where the logic of not wanting to accept that masks work kind of come from. Because if someone can say, okay, well, that mask doesn't work, then they can kind of come to the logical conclusion that, well, no, actually it is personal control, because this mask doesn't actually do anything. And that's why, kind of like I said earlier, I like to point to the CDC close contact guidance, because then I can say, okay, well, if your child does not wear a mask and my child is wearing a mask and your child has COVID, okay, just pretend the mask doesn't work. But by the CDC close contact guidance, my child's going to have to quarantine. So no matter which way you shake it, even if you pretend that masks don't work, your decision to not mask your child is still affecting my child.
Yeah, absolutely. And, I'm watching, and there's a school district out this way in Cumberland County. I think it crosses into Franklin, Shippensburg. They've been in the news lately because at the one meeting where they were voting on their mask mandate, everybody was up, making physical threats and all this crap. I mean, the crowd was out of control. And to the credit of the board, they still passed the mandate. And I guess there was an issue. They had to re-vote on it for some technical reason or whatever, but they voted still 7-2 to reaffirm it. And now the cry from all the parents is, I don't care. I'm sending my kids to school without a mask anyway. What happens then?
I personally I think that's a really interesting question that I've thought about a good amount. It is a really tough one. I don't think the answer is harsh disciplinary punishment. I think that's probably the worst possible thing you could do. I know there have been districts who have floated the idea of detentions, even suspensions. If students come to school and don't wear a mask, if there's a mask mandate, I think that's entirely the wrong way to go about it. I guess I'm hopeful that having frank conversations with those students away from their parents and saying this is a mask mandate, you need to do this to keep your fellow students safe would be enough. I guess I don't really have a good solution though, but I don't think the answer is kind of those more extreme measures that take kids out of the classroom.
So
Russell, what do you think?
Yeah, and so I don't think it's that I don't think it's that challenging. I think it's you apply whatever you would apply to, like, if someone violates the dress code, or I mean, I don't think we should kind of do anything extra. Like we're saying, as a part of coming into the building, you have to wear a mask. You know, whatever some dress codes are, undergarments can't be exposed, or, you know, all of these things. And so whatever measures that particular school or that district has in place, I think it's still applicable to something like a mask mandate. I don't think we should overthink it. I don't think, you know, don't give it a whole lot of weight and make it such a big deal. I think it should be looked at that same way.
But I guess you're right, and I agree with you to some extent, but my question is, it's a little different, because if someone violates the dress code, right, they can sit in the office until their parents come and get them, right, or whatever, bring a sweatshirt, whatever it might be. But this is a little different, because if we're talking about it from a public health point of view, you know, by taking these kids that aren't masked, do we just do they get to go in the classroom and do, you know what I mean? Like or when their parents come to get them and, they're not going to be wearing a mask, right? Because it feels like some of these folks are just spoiling for that fight, right? They're going to make it difficult. Whereas your kid violated the dress code. Okay, we'll come deal with it. You may disagree or whatever. But this feels like it's going to be, they're going to come in, phones recording, ready to roll, looking for an argument. And, I think it puts schools, the administrators and the staff, in an incredibly difficult position to have to, by necessity, police that, because you can't just look the other way and be like, okay, go back into class, because now you've just upset the entire apple cart of saying, you've now theoretically exposed those kids to a risk that they shouldn't have been exposed to.
No, I agree. It has to be like dress code. If you show up at a school with a mask mandate and you don't have a mask, you don't enter the building. I mean, if you're on a bus, you have to have the mask on, so they shouldn't even be able to get on the bus without a mask. I agree, Jesse. Some parents are going to show up, but I think that'll be a small fraction. What concerns me more, and you might want to put me off on this topic, but I think that this is being done purposefully. I think that this is a tactic that the GOP is using to destabilize public education. Because on the one hand, we have parents saying, well, if you mandate masks, I'm going to pull my kid and put them in a charter school or homeschool. You have parents saying, if you don't mandate masks, I'm going to pull my kid and put them into a charter school or a private school or homeschool. And the problem we're having is there's not a single online private charter, right? There's a difference between a true nonprofit public charter and these ones that are managed by education management for-profit companies. And I'm speaking specifically to those online charters. Not one has met annual yearly progress, ever, in the state of Pennsylvania.
Yeah, they're garbage.
So we're giving our money to schools that are not meeting basic education standards. We have a Republican-controlled legislature. And look, people say you make it political. Nope, I'm just pointing out the facts. The Republican-controlled legislature will not pass charter school reform. This is a way of defunding public schools. And that is my concern. And because this mask issue is not the real issue, but it's a way of getting to the teacher's pension fund. It's a way of getting to property taxes, because when people start to understand property taxes go directly from your house to your school, there's no way for them to launder that money into earnings per share for their corporate donors, right? So that's my thing, is they're doing this. The pandemic was an opportunity for this to happen, right? So they saw it, and the side that wants to privatize schools is jumping on that opportunity to say, hey, we can create this whole circus and we can create all this emotional distress in parents and convince them to remove their student from public school. 90% of the students in the United States currently are in public schools, and democracy in America is built on public education and free public education. So destabilizing schools, I believe, destabilizes our democratic process.
I will say one thing to that is, at the school board meeting I went to, and Lisa, you know a little bit about my background. I know what astroturfing looks like, right? I know when everybody kind of, I know when there's a plan and being executed in front of a meeting. And I definitely got that vibe with the folks that were getting up and speaking at my school board meeting. It was interesting. 2 of the first 4 speakers did not have kids in the district. And I'm thinking, you shouldn't even be allowed to speak. Right. I mean, it felt like everybody had their role to play. There was, I work for 3M and this and this. And let me tell you why masks are bad. And I do this. And let me tell you why. It felt like a school play. Not to say every parent there was like that, because there were some people that, you could tell were kind of just there. But there was a core group of people that I felt like this is what they do. They're going from school district to school district to school district, and they're making these same arguments. And yeah, so I definitely get that I definitely did feel that there was something a little nefarious at play. I don't know if it's as, well thought out as you described, at least at that level. But it definitely did feel like there was an element of kind of astroturfing going on there. And it makes it, but again, then when you try to call that out, then, how dare you? And it turns into a whole other thing. But I guess, let's take a step back then and look a little bit into the future. What do you think the political implications will be for this fight? Right? Whether, some schools are going to have mandates, some aren't. Some are going to end up closing, some are going to stay open. It's going to be a mixed bag, most likely. Do you think, as we look forward to like the governor's race and we look, down the line, do you think this is going to be used as a political football?
I do.
Go ahead, Lisa.
No, you go. That's all I wanted to say. I do.
Yeah, I think that's the intention, but I think it's backfiring. I can't remember who the pollster was, but a recent poll looking at bans on mask mandates, I believe it was something like 62% of people were against bans on mask mandates and like 38% were for. So I don't think it's a winning message for the Republican Party. I know lots of Republicans in my school district that are for mask mandates. They say it's not a big deal. Yes, it's just a piece of cloth. It's really not consequential. We can see data that it works and it's going to keep kids in the classroom. So yeah, by all means, mandate masks. It is and like you said, there's a lot of people that come to the board meetings. I wouldn't call it as much, astroturfing, at least in our district, because it definitely is a lot of parents of students in the district. There are a lot of people that don't have kids as well. But it's a very small sect of the population that is really passionate against these mask mandates. And I think it's just not a winning message for the Republican Party. I think a bigger, astroturfing by the Republican Party is definitely the CRT messaging. And I think that's probably a lot more effective for them. Polling is a lot more in their favor in that end. So if they want to make, mask mandates the hill they die on, by all means, I'm very for that.
And for some of them, it may literally be the hill they die on. But you're right. And CRT is definitely, I feel like they were like all geared up for CRT. And they're like, oh, wait, let's do this mask thing first. And then we'll come back to CRT because it's going to be there. That's a whole other, that's a whole other podcast unto itself.
Yeah. Let me know when you do that podcast, Jesse.
I will, because
please do.
I definitely, it's going to be more than one because, you look at how many, we'll take a little side tour here. Look at how many people lost or got beat up in down ticket races in 2020 on defund the police and BLM. And, it clearly to some extent worked for Republicans, in down ticket races. CRT is going to be like that on steroids, right?
So it's because of those 2020 down ballot losses that they're taking CRT and they're using it. Because if we start to teach more equity-based teaching methods, because look, in elementary, and I'm going to let Dr. Patterson speak to it more, but what we were doing here in Phoenixville is we're going to not only trauma-informed education, but equity-based education, because the achievement gap is one of the largest cost drivers in public education. And if we use equity as a foundation, you can reduce your achievement gap, you can reduce your cost. They're conflating that with CRT because they saw that kind of inflammatory, nonsense messaging worked for them. And it disturbed the vote. It literally created a ripple in the force.
I always tell people if they wanted, I said, I'll talk with you about CRT if you could explain to me what it is. And more often than not, that's pretty much the end of the discussion. But yeah, that's, we'll come back and talk about that one another day, because that is definitely a podcast unto itself. Another thing I wanted to talk about was, as this is kind of evolving now, so for example, in my school district, the board came back with a safety plan that said optional masking, but if the state does mandate, we will follow that mandate. And, so like everybody was happy and nobody was happy as we left. But it felt fairly well reasoned. I was very impressed with our superintendent. Some of the board members give there's an anesthesiologist on our board, give a very well reasoned, thought process and everything. But immediately then the debate shifted to exemptions. And it was, we want a religious or a philosophical exemption. And to me, I think that's insanity, because it totally undoes the entire point. And I'm seeing now there are districts across the country that they're pressuring their school boards to change the exemption from a doctor's signature to a parent signature. And that's happening in like Kansas and some other places. But you know how this stuff works. It catches on and it'll start to be the thing. How do you think, what are your thoughts on the exemption issue and how we navigate that?
But Jesse, you said so. Your district decided not to make masks optional.
No, they decided to make them optional, not mandatory.
Not so. Yeah. So I'm gonna be honest with you. I have a problem with that, and my problem with that is, I think the caveat in any situation should be the children who are under 12. So that means you have elements. So as an elementary person, you have buildings filled with students that were not able, 100% of that population had no option to be vaccinated. To me, that makes no sense. And I think that's problematic for me. Now, I can give it to a district that would say, you know what, if your child is 12 and over, we're going to go to school, and they have that option. It's somewhat questionable with the Delta variant, but I can sleep at night a little bit. But when we talk about that 11 and under crew, and we're saying that it's, optional for them, and none of them have had, like, we're just waiting for it to run rampant amongst the students, the teachers. That's problematic for me.
Yeah, my kids are 6 and 7 going into kindergarten, first grade. So yeah, I'm right there. And that was my whole point was, hey, because that was the one response I was able to give that could kind of shut the room up. Choice. My kids don't have a choice. They're the only ones that don't have a choice in this. They're under 12. They cannot be vaccinated yet. So that, that you're right. It's a huge part of it. But
so don't forget then there's the staff. So, and the staff,
right.
They have little children at home, possibly. Some of them are taking care of their parents, and so it just jeopardizes a whole community of people. And I can't, it's a problem for me when I hear that they're just making it optional for the entire district.
Yeah. Well, it was interesting. So we just got an email from the superintendent today saying that they're taking everything under consideration and they're going to be making some announcements or clarifications or whatever, because they started a petition out here. I think we got like 700 signatures in like no time, to go to mandatory masking. But at that school board meeting, it was like 85% of the people there that spoke on the record were anti-mask, and that, so there wasn't a lot of pressure placed the other way on the board. I mean, I wrote an email myself in advance that put a little pressure, but it wasn't, and the thing that bothered me, and I want to get your thoughts on this, is that in kind of mollifying or kind of trying to bring everybody together, because in our district, I've only lived it for 2 years, but, and it's regarded as a very good school district, the Mechanicsburg School District, but everybody was fairly well behaved. There weren't shenanigans. There weren't yelling and screaming. There wasn't any of that stuff. It was pretty well managed. But there was this idea of, well, it's great that we have both sides, and both sides could be civil. And I'm thinking to myself, but are there really both sides? Aren't we kind of giving a little more credibility to this anti-science perspective by saying it's two equal sides?
So I think listening doesn't give it equal weight, at least in my mind, and I don't think it does in the mind of others. As an elected official, you have to listen.
Sure.
But at the end of the day, the vote is your personal conscience. There were many votes where I had to speak and say, I want to explain why I'm going to vote, even though I heard everything you all said. This is still the right thing for the children. I always explained that there were 3 points of decision that I looked at when I had to vote on anything. How did it impact my students? How did it impact my staff and faculty? And how did it impact my taxpayers and community? And it was in that order. So if the first point for me was this would harm my students, it was a simple decision. And I think for this is the same thing. We're going to see school boards and superintendents make a decision, even if it's against public opinion. We have 3 teachers, and I understand, sadly, a 4th just died in Florida from COVID since they've returned.
Florida. I mean,
we're seeing school boards in Texas defying the governor's, anti-mask order, into putting it into the dress code to get around his, ridiculous attempt to not allow masks. So I think it comes down to conscience. And this is not a political thing. There are many good, conscientious Republican board members who want to protect their children, their staff, their faculty. They are going to do the right thing, I believe, at the end of the day, even if they personally may not want to wear a mask. It's not about them either. It's about the children and the adults in those buildings.
Right. So I think it's a really, from our standpoint, it's a really clear decision, right? Like, it's a slam dunk. Masks are not a big deal. They prevent the spread of COVID. They're going to keep kids in the classroom. But I mean, clearly your board doesn't feel that way because you said your board left masks optional, right? They're not being mandated.
Right.
So I think we have to remember that, other people are coming at this from a completely different mindset than we are. To me, I mean, my job is mainly interpreting data and making engineering-based decisions, and I look at the available data, and I'm like, well, this is obvious. I mean, I'm also a mentor for immigrant and refugee children that mostly don't speak English as their first language. So if there's going to be any group of kids who are affected by masks, who have trouble communicating, have trouble connecting, it's probably going to be those groups of kids whose English maybe isn't as good as other students are. Again, no impact whatsoever. So from my standpoint, this is so clear. But again, from other people's standpoints, it clearly isn't. Clearly there is a legitimate argument in their minds.
I also just to jump in there too. As a principal, parent, I don't take when parents drop their children off at school. I am the caretaker. My staff, we are the caretakers. And I don't take that lightly at all. So in any type of decision, I'm always going to err on the side of caution. Like even to the point of saying, oh, why are you? That's a lot. I take care of people's children. That's part of what I do for a living. So at the end of the day, if somebody said, you know what, we had to fire Dr. Patterson because he was following the CDC mandate, I'm okay with that. If that's the reason I got to go, I'm saying peace. And I'm okay with that. He wanted to make sure the children, he felt like this was what needed to make, keep the children safe. Like, I don't take it like, that's why for me, and I know maybe different for a lot, it's like really black and white. Like, it's not, this is what the experts are saying. These are what this is the decision we have to make. And this is what it is.
Well, it's interesting that you mentioned that about being the caretaker because, at the meeting I was at, that was one of the big things that came up was a lot of the anti-maskers were saying it's not your job to protect my kids' health. And I'm like, what the hell?
But they were all screaming how much they wanted their kids back in school just 6 or 7 months ago, right? And because then it was the job of the teachers and the administrators to take care of their kids while they go to work. They want it both ways. And that's not the way a civil society works. In a civil society, we work for the common good, and we have to do what's best for the greatest. And putting our children at risk. Look, the biggest thing that I talk to parents about who are anti-mask right now is the long-term impacts of COVID. We don't know them. I know some adults who have had COVID, and they're still having and feeling impacts. And we don't know what that might do to our children. Why would you want to put your child where they could have a long-term illness. And again, that's an argument that does seem to get through to these, people who are anti-mask. And they're like, oh, wait, I wasn't quite sure about that. And if I send them more info and you can, talk through that. And I always explain, I'm not trying to tell you how to raise your child. That's not what this is about, but it is how we're going to behave while we're in school. That is the job of Dr. Patterson or the school board, setting policy. But the administrators, they're the CEO of that building. That's how I look at it. So they absolutely get to, oversee and make those rules.
But then there's the other piece, I think, where I'm hearing like some schools may make the children bring their own mask and then if the kid, then that's all no. So as the school, let me tell you, I'm gonna make it as easy. I'm gonna have all kinds of masks, different sizes. I may even try to get some colors in there. Some of the kids will tell you, I don't like the way my breath smells. All right, I got mints and gum and things like that for them. I'm gonna keep hand sanitizer. You just wanna, as the school, we don't want to be a part. Look, we're just trying, we're not trying to battle with anybody. I don't like this. Okay, well, maybe I might have a red one or something in my. You like red? What color do you like? So we have to also, not position ourselves so adversarial. You have to make sure we just pivot, work with them, see what listen to what the children are saying. Oh, every day it's hard for me to breathe. Okay, do you need a little, do we need to give you a 2-minute break? You need to go to the bathroom when no one's in. I don't know, figure something out. But just we can't battle. Let's not battle over this, and that's too much.
So
and it's fun. I'm sorry, Lisa. Go ahead.
Just on that needing a break, part of the CDC guidelines, the mitigation strategies are much more than masks. This has become all about masks, but another part of the mitigation strategy is cycling the children outside regularly, because fresh air and soap and water are two of the best defenses we have against COVID. Masks are next. So elementary school children, washing hands regularly, whether that be, every hour on the hour or whatever works in your school setting, but also every 90 minutes, I think was what I had read somewhere. I don't know if that was the American Academy of Pediatrics or the CDC. I read so many of these guidelines, but regularly getting the kids outside in fresh air and giving them that opportunity now, because right now, if you're in low transmission, you don't need masks outside. So get them outside. And look, 20 minutes of sunshine a day has been shown to also alleviate stress and anxiety. So when we're talking about these kids are more stressed out because of all this, well, get them outside playing, and that's going to help as well.
You just segued into something that I wanted to talk about, which was the impact on kids. And one of the arguments that you hear is, against masking and all this stuff is, and also as a co-argument, like you said, of kind of like trying to have it both ways as to why we need to be back in person is because of the mental health impact on children. And I'm in no way trying to minimize that. I luckily, my kids were young enough and they have siblings, they're 14 months apart. We didn't have to live that piece of it, but I get it. And there's no doubt about it. It was interesting. We had one girl, maybe I think she was 16, 17. There was one student showed up at the school board meeting to talk, and she talked about the being spit on for wearing a mask last year, for being mocked, for having teachers openly call COVID a hoax in front of other kids. And it was interesting because she looked at the parents and said, where's that grace that you've been asking for? Right? Where is it? And that's one of the things that I worry about is by having masks optional in schools, my kids are going to wear a mask. Well, other kids aren't going to be wearing masks. Are we not taking that argument kind of into the classroom where it kind of the last place we want it to be, about, why kids are wearing masks and why aren't? Well, my mommy says masks are stupid. And, is that a realistic concern? I mean, to me, it feels like it might be.
I definitely agree. I mean, I know one parent whose kid was already bullied because he went to football practice and he had his mask on because they were doing paddle drills, and another kid was making fun of him, telling him to take his mask off. So, I mean, I think that's definitely going to be an issue. I think, kind of like Dr. Patterson and Lisa both said, we want to make this as easy as possible for kids because, and like you alluded to, they're bringing in what their parents say with them. So they might not actually have a problem with masks, but if every day their parents are telling them how masks are ridiculous, they shouldn't be wearing them, you've kind of got a battle to fight there. You want to make this as easy for the kids as possible. You want to give them options, like Dr. Patterson said, different masks. If they don't like a certain type, they can wear this type instead, because you are going to have those issues. If it's optional and most kids aren't wearing them, you're going to have option one where a kid gives into peer pressure initially and they just take their mask off, and then, maybe they get exposed to another kid and have to quarantine for 14 days or out of school. Or two, they try to hold strong and keep their mask on, and then the other kids make fun of them. I absolutely think it's going to be an issue.
Russell, your thoughts?
Yeah. So I think this conversation taps into a bigger issue. So I think that you're really addressing like what we call the culture of a school. And so you can take mask off the table and you can put religion. You can take mask off the table. You can put race, different race. You can take mask off the table and think about LGBTQIA. You can put that. So now we're actually talking about the school culture and what type of culture this school has, and being intentional about if it's optional. Some people can wear masks. Some people, don't wear masks. Some people have glasses. Some people have darker skin. Some people have lighter skin. So I think that comes into a school culture, and a lot of the times, speaking from experience, like the school culture can almost, most of the time in my experience, override like what the parents are saying at home. And the kids could come in a positive school culture. You'd be surprised when they can just fit right in despite what's being said at home. So I think those kinds of conversations, and if the kids are doing that taps into what's the bigger issue, what's the culture of that school, and how was that mistreatment allowed.
All right, you just made me feel better. Thank you. No, I mean, seriously, because it is, we are putting so much on the educators. Just in this conversation, there basically have to be, in addition to educators and everything that comes along with that, we're putting all of these responsibilities on them. And, I think you're right. If there's a good foundational culture there, it's not going to be a thing. And obviously there are always going to be some exceptions and outliers, but I think you're right. And it comes down to, if we do believe that the schools and the people that work there have the best interests of our kids at heart, we've got to have faith in them to be able to manage those things the best way they can and be there for assistance whenever it's needed. That's kind of the way I look at it. So we're coming up on an hour. I'm going to try to wrap it up, but I wanted to do, first of all, is there any major issue that we didn't hit on with this? I think I went down my checklist. Is there something else about this that we should be talking about that we haven't?
I think the only other point I would like to make is that I think the lack of leadership from the state has put an unfair burden on our local school boards. It is the role of school boards to set policy, right? There's only like 3 things in the school code that's what school board directors are defined as being, responsible for. But in this case, we are in the first pandemic we've had to live through in this generation. No one knows what's going to happen next. We're all learning this together. And I do feel what you said in the beginning, the local school boards are being, it's being punted to them unfairly, and they are dealing with all this vitriol and hate and anger. And it is time for our state legislators and our members of Congress and the State Board of Ed and the State Board of, Health to step up and really take some leadership.
So that leads me to the kind of the last question is, where are we 6 months from now? Where do you think we are, kind of overall in terms of, has the state stepped up at some point? Are are our schools open? Are they closed? Where do you think we're heading? Lisa, you're first.
Sorry, I had my mic off. So 6 months, that's February. And it's flu season. What we found last year, what the CDC found, was there were very few serious cases of flu last year because of the masks that we were all wearing for COVID. So if we can get enough districts wearing masks, I think we're open, we're thriving, our children are doing well, they're sledding. Hopefully we can ski for those of us who do that. If we get that done in the districts that haven't done that, I think they get into a vicious cycle of closures and quarantines. And I think it'll be really a stark contrast.
Russell, your thoughts? 6 months, where are we at?
So, Jesse, I don't see it as positive as Lisa sees. And I hate to say it, again, I'm thinking about elementary schools where no one is vaccinated. I mean, my kids love to hug and high five and all of that kind of stuff. And now we're getting ready to put them all back in the building. I'm 100% for 5 days a week, but I cannot see. We're kind of, the good thing is the adults have the option to be vaccinated, but I feel like we're headed back down a road to where, I don't know if we're going to be back into a, some kind of virtual something. I don't want to say full closure of schools, but some semblance of what we've seen before. I don't see any way of avoiding that, especially for my little ones.
Dan, 6 months, where are we?
I think it's going to be a bit of a two-pronged story. Kind of like Dr. Patterson alluded to, vaccines are a huge issue. Thankfully, students 5 to 12, from what I'm seeing, they should have the opportunity to be vaccinated by October. So hopefully parents will be taking advantage of that. Yes, fingers crossed, and that we will be able to get those students a certain level of protection. I think that what we're really going to see in the more immediate future, like we've already started to see, is that schools that don't mandate masks are, like Dr. Patterson said, they're going to be shutting down. They're going to be having mass quarantines. And I think what you're going to be seeing is the schools that are mandating masks, they are going to have students out. They're going to have some teachers out. But I think by and large, they're going to be able to continue in-person 5-day-a-week learning and kind of get through this from an education standpoint relatively unscathed compared to the schools that are not mandating masks.
Yeah.
And hope. Go ahead. I'm sorry, Lisa.
No, but for a future podcast, because I know you want to wrap this up, we have to talk about this culture of people don't feel they can take off work and stay home when their kids are sick. Sending kids to school sick has been a problem forever. It's just so much more serious now. And I've actually said from the very beginning, we need isolation spaces. So if a kid comes into school with the sniffles, they need to be isolated immediately. And we need to work with local hospitals. We need to, gymnasiums can be turned into isolation, or, nurses' offices may not be big enough. But that in January and February, if we're going to keep schools open, is going to be absolutely required to have isolation spaces in public schools.
Yeah, we do. They have that in the district where I work. They put those in place. We call them the cares room, or that's our term for it. But it's a space where if they have the sniffles, they can be isolated, gently isolated, or, So I definitely agree with that.
And Dan, to what you kind of predicted, I agree with you, and I can only hope that as this process plays out, if we're starting to see the data that shows that districts with mask mandates are staying open and thriving as compared to ones that don't, that even despite a mandate from the state or wherever else, that those school boards will be willing to come back and say, you know what, we do need to go to a mask mandate. We do need to make these changes, and be willing to kind of make that about face, that pivot is needed. And because I think that's ultimately going to be the thing that gets us all, paddling in the same direction. All right. Well, I want to thank you all this has been the 1 hour of most intellectual conversation I've had about masks in schools in as long as I can remember. It's wonderful to be talking with people that are all kind of the same mindset, but have different experiences. And clearly you're all very invested and very involved in this issue in your particular community. So, and to the 2 elected school board members, thank you, or the candidate, and thank you very much for running. School board is one of the most thankless but important positions out there. I've said that from all my time in politics. You've got to be nuts to run for school board unless you have some sort of weird ulterior motive. So thank you very much, because I think this crisis has demonstrated more than ever how important it really is to have people that are really care and really analytically thoughtful and compassionate and really do have the best interest of the kids at heart. So thank you for that. Does anybody have anything they want to add?
No, thank you for having me, Jesse, and I look forward to let's have some other conversations. There's so many other topics that we can talk about that are really interesting and that impact our children across the state. So hopefully we can come back and talk about some other things as well.
Absolutely. So if you live in Bethel Park, you're voting for Dan Gryzbeck for school board. If you live in Pine Richland, you're voting for Dr. Russell Patterson. And if you live around Lisa,
call me.
Yeah, if you're anywhere else, just call Lisa and bother her. So again, thank you very much, Lisa Longo, Dr. Russell Patterson, Dan Gryzbeck. Thank you so much for your time. Do me a favor. Once I shut us off, please keep your browser open long enough so it uploads all of the files so everything's synchronized.
Great.
All right. Thank you very much, everybody.
It was a pleasure to meet you both, Dr. Patterson and Dan, because I can't pronounce your last name properly, I'm sure.
Nice to meet you.
Good luck.